Good afternoon, everyone. My name is Tim Markle, and I work with the Youth Health Transition Initiative out of the Wasteman Center. With me today, I have two teens from the PATCH program, Providers and Teens Communicating for Health. Love them, love the group. I have been fortunate enough to work with these two teens before. And so I am excited that they are able to work around their schedules and be with us today. We're going to flip the schedule a little bit, and we're going to hear from the teens first, and then we're going to go ahead and I'll give you a short overview of youth health transition for those that are new. So I'd like to start with Aaliyah. Aaliyah, if you would care to go ahead and introduce yourself and tell us your story about interacting with the medical system.
Hello, guys. As said before, my name is Aaliyah. As you can see on the slides there, I use she and they pronouns. I go to DC Everest Idea School, which I am in right now. So if you hear background noise, that's the kids having lunch. And I am in Wausau, the general Wausau area at least. And I'm a part of PATCH because I've always thought that the action of assisting people throughout whatever methods we're able to do has something that's been held close to me in my heart. And I'm someone that has struggled with healthcare transitioning and just general respect in the healthcare system, if we're going to be honest. And my brother as well, he is nonverbal and autistic. He struggled with that as well. So I've seen from a personal perspective and an outsider perspective in unique ways. I have more of the physical healthcare disadvantages in that, and my brother being mentally handicapped. I decided that I would start talking more about this through PATCH, and I got the amazing opportunity to present with Tim, and we've all hit it off as a group, and I'm so excited ever since. But my story begins even before being in PATCH, because I began showing my symptoms of chronic illness when I was about 6 or 7 years old. Horrible migraines, stomach aches all the time. A lot of it was chalked up to anxiety, which I do have anxiety, so that does kind of fit, but it just got a lot worse. I would go into flares as well, and I had a lot of joint pain, which is not average for a young child. So what ended up happening is I kept getting dismissed very frequently. Luckily, my mother was very persistent and helping me out with that. But eventually, when I got older, I was about 11 years old when I went into my worst flare-up, I suppose. And it was bad. I missed quite literally about 60% of school, which is not good for your first year of middle school either. So going to the doctor's office so many different times, and I was dismissed so frequently because the reality of it is not a lot of people are there for people like me in the healthcare system. Part of it is definitely just because people with different abilities are not really perceived the way that needs to be happening in the healthcare system. But the fact that I hold intersectional identities, I am Afro-Latina and a girl. So a lot of that was chalked up to me exaggerating things. But the reality is I did get a diagnosis eventually, but it took all too long. And when I was in those rooms, I noticed a lot of the conversation was directed towards my mother, right away asking all the questions. Oh, so how is her knee feeling? Blah, 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 all those different things. But by that age, I can definitely answer those own questions for sure. And here's the thing with that. A lot of people don't realize that different ages don't necessarily all mean the same thing. One 5-year-old might be ready to have a healthcare conversation, at least limited with their doctor. Another one might not. Different things like that. So it's just really about personalizing. And I know that's so hard to do when you don't have a lot of time with these kiddos. But the truth is that we have to try the best we can, because this is not only their ability to be healthy people, but to advocate for themselves to be healthy people. And that's what I like to educate when I'm here working with PATCH and on a typical basis as well in my personal life. So I've been working on becoming more independent with that, because the only reason I got diagnosed is because I said enough is enough. I'm going to talk to doctors. I'm going to tell them that this is my situation. And I have started taking even more independence. I very recently went to get for my prescription medications, pick it up the first time. I've been able to have schedule my appointments more. It's been great. And honestly, I couldn't ask for more. But the thing is, so many people, like I said before, have different boundaries for what is healthcare independence, depending on their age, right? Depending on their abilities, depending on their connection or relationship with their parents. So I might be 16 and deciding that, yes, my healthcare independence is that I am going to be picking up my medications at least every other time, and I'm going to be at least on call for every appointment that's being scheduled. Things like that. Those are my boundaries I set. For example, my brother, on the other hand, being nonverbal and having some sensory issues, for him, healthcare independence is not really going to look like anything more than at least just being in the office, because even that can be overwhelming for him with those like fluorescent lights and everything, all that conversation. So that's his healthcare independence, and we are so proud of him for doing that. But it looks different for everyone. So that's what I'm here to advocate for.
Thank you so much, Aaliyah. And hopefully you can hold on. What we'll do is I'm going to have a conversation with Dina, and then I think we'll go ahead and we'll open it up to questions for Aaliyah and Dina after that, so that we can maximize their time in the middle of their day. And then however much time we have left to talk about, what is health transition, we can do that. That's not a problem. So Dina, I'd like to bring you on now. And just ask you a few questions. First of all, do you want to go ahead and tell us sort of who you are, how old you are, what do you do for schooling?
Hello, I am Dina. I am 15 years old, and I am on an online school currently, because the in-person school system is kind of hard for me. But my pronouns are she and her, and I joined Patch because, similar to Aaliyah, not all of my healthcare experiences have been good, especially a few years ago. So I needed to join Patch to make a difference and talk to healthcare providers and talk to people around healthcare providers on how to make a difference and treat people who aren't always like people maybe with disabilities or disorders who maybe might need different things, how to work with them better too, specifically. That's my specific reason. And very similar to Aaliyah, for me at the beginning of middle school, I kind of went in this very extreme place where I couldn't talk for 9 months, and I lost a lot of abilities. Like I couldn't go up and down stairs. I lost my ability to talk. I couldn't write. Like all these things kind of happened to me, and I needed to get a bunch of healthcare providers around me, but a lot of them kind of wouldn't even try to talk to me at all. They would kind of talk just to my parents, and it would end up not really being helpful because my parents would end up talking for me, and they don't know me better than myself. So
No, that's Dina, you can keep going. You are just rolling. You
Oh.
just keep telling your story. I was just saying, good job. I love the way you are advocating for yourself.
Yeah, so I I am trying to figure out how to like pick up prescriptions now. And I haven't really learned how to do that quite yet, but that is something that I've talked to my parents and talked to my healthcare providers recently about a little bit more. So that is kind of the journey I'm on now with healthcare. But I haven't fully done that yet, and I haven't like really since like I can't drive yet. I don't know. I haven't gotten to my appointments, but that is something that I am trying to figure out. And like Aaliyah said, like every person needs something different, and depending like just because they are one age doesn't mean that every person in that age bracket is going to be the exact same. Yeah, so I think that is kind of the journey that I'm on, and yeah.
I have a couple questions that I'd like to ask Dina and Aaliyah. So you both mentioned that you appreciate it more when the doctor talks directly with you and not through your parents. We know that happens over time. Are there other things besides talking directly with you, other ways that health professionals can help you take charge of your healthcare? What else do you find helpful from people in the healthcare system?
Yeah, I could go first. So I think another one of the biggest things for healthcare providers to do is be patient and not try to rush appointments. So to be patient, understand exactly what the team needs, and understand that I might not always be able to answer your question exactly right. So kind of make a plan with the team. Yeah.
Thanks, Dina. Aaliyah, what else would be helpful?
I definitely agree with that point, but I also believe that something really important is keeping away from assumptions when we're discussing our health, because yes, sometimes they can be really important to make really quickly, because I know you guys are always jumping from appointment to appointment pretty often, and I know that you don't have a lot of time, like I said before, to get to know this person, so you have to go with that little bit of information you have. But the truth is that it's very difficult to make those assumptions, because yes, some of them can be unintentional assumptions or intentional. And the truth is that when you make these assumptions, you might even consciously be thinking to yourself, we don't know if this is true, but this is likely what's happening. That's still kind of not, this can be referring to the health of someone, saying, oh, just because they said this, they might be exaggerating a little bit, like I've said that I've experienced, or maybe even just their vocabulary and the way that they describe the pain. What if the way that they say pretty bad, it hurt pretty bad, is way different from what you're saying? Because of course there's that aspect of everything being different to different people's perception. So we always have to keep in mind what's going on with that, especially based off of people's life experiences. I'm an AP Psych student, so I have been focusing a lot about how perceptual sets of mind can really change people in their perception of what's going on in a conversation. And I've noticed that a lot of that can actually happen in a doctor's office that people don't realize.
So Dina and Aaliyah, how do you like to get information about your health from healthcare professionals? Do you like direct conversation? Do you like handouts? I love giving people handouts. How do you prefer to get the information you need to keep yourself healthy?
So for me, I like when the healthcare providers will kind of be more straight up about it to me, but I don't exactly like. It kind of depends on what the information is for me, which is kind of hard. It makes it harder, I think.
Can you think of an example that you could share, Dina?
Like for information, specific information. Yeah, okay. So when I was diagnosed with autism, the healthcare providers kind of never told me directly. It was always, it was on a big big long long like pages of writing, and somewhere in that writing it kind of said briefly about that I have autism, and they never told me that, which I kind of wish they did, but it's okay. But so it kind of ended up being like a few months afterwards, I think, where my parents ended up kind of having to tell me. And that's an example of maybe where it wasn't ideal for me, because I like more straight up communication with my providers. So I think maybe that's an example of where it would have been better for it to be more like they would have just told me kind of more straight up. But I guess since they didn't have that conversation with me, it was harder for them to know that.
Thank you. I love that. I think that's a great point. Aaliyah, how do you prefer to get your information?
Like said before, everything is so personalized. I know that, like, for example, direct to the person, maybe verbal. I, on the other hand, prefer like handouts, things like that. And afterward, like a lot of conversation about what that means, because I'm someone that I suppose has a pretty good sense of like medical vocabulary. So I oftentimes will understand the word even when the providers will start to explain it to me. But I still like to have that like reassurance that they are willing to explain that to me, even if I already know. Even if it's something that seems pretty elementary to me, the fact that they're willing to explain that with me and also work with what I do know and willing to have that open communication rather than saying, this is what happens, the end. I like having that opportunity to ask questions, see what's going on with like, what does that entail? What are symptoms, blah, blah, blah. What are some like similar diagnoses that were like potentially debated with this even? Different things like that. I like that chance of communication, but I do agree in the fact that keeping things very concise when it comes to those important bits, so we have that main takeaway, and then open up to keep it nice and open for questions and conversation, and very casual conversation as well. We don't want you talking down to us, even if there's things that we don't understand. There's that aspect of like, especially teenagers, especially of us being old enough that we have more adult-like conversational skills oftentimes, depending on the person, but also young enough that we still want further elaboration.
Well, in addition to those adult conversations that you just mentioned, Aaliyah, I know that a lot of it, that some of this also has to do with decision making. And there's a lot of decisions to be made in healthcare. So could you guys just talk a little bit about where you are on who's making those health decisions? How do they support you in making health decisions? How do you want those decisions made in the future? So about decision making. And that was way too many words. My apologies. So let me simplify it a little bit. So who supports you in staying healthy, in making good health decisions?
Yeah, so I think like my parents are my main supporters, and I also think my providers are too. But I think um, my parents are the main supporters, so I can kind of go to them if I need something, and they're able to kind of understand what I need, even if I'm not super direct, because it's hard always to do that. So I think they are able to help me with that. But in the future, that is going to get harder. So yeah.
What are you looking forward to in the future?
Looking forward to, I think if anything, I think like I'm a little bit nervous about having to take control or be in charge of my healthcare when I'm older, because that is going to be kind of a drastic change. So that is going to be hard for me. But I think I'm looking forward to having more independence and being able to kind of be the lead person in my own healthcare. So that will be good in that way. Yeah.
Fantastic. Thank you. Thank you so much, Dina. Aaliyah, how is your decision-making process and support?
Lately, I've been doing an awful lot more of it on my own, but I usually have my mom there beside me, and also my sister, actually. I have a very good bond with my sister. We're like besties. She's off in college, but we FaceTime very frequently. And she actually helps me out quite a lot because she's someone that's been through that healthcare transition very recently. So she knows what it's like from that perspective. She knows a lot more about healthcare transitioning than my mother does. She hasn't done that in a while. And my mom still calls her mom to talk about healthcare. So, and that's perfectly fine to still have that bond, but my sister has had that transition more recently. So I'm able to connect with her in that way, but also talk to her on a personal level. I do really appreciate a few of my doctors out there that have been helping me and looking out for me with that as well, though.
Well, I would like to take a break from my asking questions, and if you guys can hold on for a few more minutes, like to open it up, see if there's any questions from the people on from the learning community today for Dina and Aaliyah. Beth, is there any special way they have to do to ask questions?
No, I think raising your hand would be fine, or just unmuting and talking. That's good too.
I see Maria has her hand up. Maria, what
Yeah.
question would you like to ask?
Well, I'm thinking about I listened to Aaliyah story, very interesting, and Dina's too. You know, there's a lot to be proud of these two young, strong women. But my question is, me being a mother of a 25-year-old, is what you will like to tell your parents about your transition to adulthood? In other words, to let go. Do you think that sometimes your parents are too overprotective and infantilize you with their best intentions about stopping you to taking risks and things like that because they don't want you to get hurt? And what would you like to tell me? Tell me to say, Mom, please step back, or what do you think would be a message for us parents who are listening to you about how to better support our growing kids? Thank you.
Yeah, I can take that. Thank you so much for the question. That's a very great question because honestly, I love the fact that you're seeking out that information, whereas many parents would just be covering their ears for that. And I appreciate how you're so open with that question. I know that when I discussed earlier, my doctors were talking to my mother instead of me for healthcare. questions she was answering right away and not even giving a second thought as to maybe that they should be talking to me. So like the first step that we took for healthcare independence is I had a conversation with her on the car ride home from one of those appointments, talking about how that made me felt. And she backed off a little bit from that. But then for further healthcare transitioning, I know it is so scary to let that happen because a lot can go wrong if you don't do it right. Looking at like financial things as well. But the truth is that it's so important to let go. And I know that you realize that too from the way that you're asking that question. So I know it looks very rough. I know it's so scary, but the truth is these people need to build up that independence. Those kids need to build it up because it's not only about healthcare. The truth is that they're not going to have you around forever. That would be amazing if that was the truth, but it's not. And it's not only talking about scheduling for a shot or something. The truth is it goes away from healthcare too. Talking to a boss, calling in sick from work, different things like that. Just taking that advocacy for self. It's important to like start instilling that at a young age if possible, but it's never too late to break that. And there's no way that having that little bit of separation for healthcare independence is going to sever that relationship. If anything, I've noticed it actually made my relationship with my mother better. As long as you're still there for those questions, but making sure that they have those opportunities to be in those situations where it's their questions is what I'd say is the most important.
Thank you so much, Leah. Dina?
Thank you so much. Yeah.
Yes, hi, thank you for your question. Yes, so I think that one thing that like you're like maybe that it could ask is like what exactly like do you need? Because I think sometimes what happens is parents can kind of make an assumption or make an idea in their head about what the kid needs without really talking to the kid. I think that that's something that kind of happens more than you think, and I think that that's an important thing to kind of to do. And I think like kind of that both ways. Like I think that like your kid could also maybe kind of talk to you about maybe like what both of the understanding is like for whatever it is, because sometimes they can be kind of in different places with where it's kind of like it can be kind of hard if that's the case. So it's just important to be on the same page. I think that that's really important.
Thank you. You know, those were very good points. Thank you.
We do have a question in the chat. It's about Patch, about joining Patch. The question is, what is your message to youth and your peers your age to get involved with Patch, and who should get involved?
I can take that question. I think that honestly, anyone that has any interest in advocating for healthcare in general, we have all different forms of Patch around. There is like teen educators and youth advocates. So some people of Patch, we work on gathering information from our individual communities and work on like, oh, what do we need to change? And we'll have little projects that we do to like change that and make it more effective for people around us and according to healthcare needs. That can be mental, physical, or sexual health. And then we have these other groups of people over here that they do what I do. I've actually done both of them before. I did kind of like a position transfer. But what I do now is I work more so with consultation with healthcare providers. We go to like workshops basically and talk about almost what we're talking about today, just a little bit less individualized. It depends on those workshops. Just talking about, hey, what are the things that you can do better to build a better bond with those adolescent people you're working with. So that's what we do. But as a whole, I think anyone that right now, because there's a lot that's going wrong, and anyone that wants to change that for the better for adolescent health can work with Patch. If you are someone who is a healthcare provider, we love having people come here and give us their perspective, give us information on that. But also the youth, we go for like basically just teenagers, high school age, can be employed and focus on not only learning for ourselves, but learning for our community and just spreading that around.
Yeah, so I think that like with Patch, one of the biggest things is educating, but also learning. So like, I think if there is anyone who like wants to make a difference with the healthcare system, because not everyone has had either a great experience, or they know someone who maybe hasn't, or they just know that they need to make a change, they can join Patch. And just like Aaliyah said, I've a lot of the workshops are kind of similar to this. Like we have conversations. Sometimes there are scripts too that are very good for educating and teaching people, like healthcare providers or people who work with providers, about how to make a difference and how to talk to teens and anyone really. Yeah.
And I know we have Amy Olnichek, Arn, who's with the Patch program. And Amy, I was going to say, so how would you just put, darn it all, they did a great job. Is there anything you could possibly add to that, Amy?
Those were phenomenal answers. I'm glad you all took it first, Aaliyah and Dina. I don't have a lot to add other than just to reiterate that the youth are paid to work with Patch. So this is a job for them. We really work hard to make sure, they're clearly the experts and should be paid and compensated as such and celebrated as such. So it is a job we generally hire for year positions, so 9-month positions in the summer. So we don't have any youth positions open right now, but we're always taking, we have ongoing communication. So when applications open, they're ready. And then, yeah, youth like Aaliyah and Dina, who are passionate about improving healthcare, passionate about creating healthier future generations and really setting the stage for themselves as well as their peers, and the youth that come after them are invited in. And it was asked a little bit earlier, but we do have youth teams throughout the state. We have one teen educator team in each public health region throughout the state. And then we also have the youth advocates that Aaliyah was talking about, our statewide teams. So really youth from any corner of Wisconsin are invited to apply. And our Wisconsin website is in the chat, and I'll put my email in there again. Anyone who has deeper questions, wants to talk a little bit more, I am happy to chat with you or email with you and answer those questions as well. Thanks, Tim.
Oh, thank you, Amy. Sorry for putting you on the spot. I'm glad that you're here today as well. Other questions for Aaliyah and Dina?
Yeah, I don't see any hands raised, Tim.
Neither do I. And I don't think we asked this specifically at the beginning, but the question from Allison in the chat, would each of you just sort of talk briefly about how long you have worked with Patch and what makes you want to continue working with Patch?
Sure. Yeah. So yeah, I think I am definitely going to continue with Patch, probably all the way until I'm not in high school anymore, because I just I really love the program, and I really do think that we do make really good change. I see it happening. So I think that since Patch is such a great organization, and since I think I that I've learned a lot from Patch, and I think I've taught other people about Patch, I will stay with Patch because I think I can make even more changes. And I think that like one good thing about Patch is that it's not like, I think like every time I have an activity with Patch, I learn more. So it's since it's not too repetitive, and I think like I learn more, I grow more. So yeah, I'm going to continue with Patch for that reason.
I've been part of Patch for, well, this is my second year. I started out as a youth advocate, and now I'm a teen educator. We all each other, what's similar, what's different, and I love them both. And I think I'm going to stay with Patch for as long as I can, because all of the stuff that I'm doing with Patch, a lot of it is stuff that I would have been doing originally anyway. I've always been someone that advocates for what I believe in. I believe I was either 6 or 7 when I started my first protest. I believe in shaking up the system in order to build it up to be a little bit better any way we can. So I've always been involved in healthcare. So I was like, wow, this sounds like a great opportunity. I'm already doing half this stuff, but I have an opportunity to learn as well some more and get paid for it. I thought that it was like some scam, if we're going to be entirely honest, when I first found out about it, but not a scam. And I really appreciate it so much. And I think that like my favorite thing about Patch is just the way that I'm able to connect with the different members of Patch and like feel that community. Because like, for example, without meeting up for our presentations with Tim, Dina and I would have never really talked before. Like, but because we're in Patch and presenting with Tim, I've been able to conversate with such a lovely person and get more perspectives about those things that I'm passionate about. I have my whole team here in like the Wausau community for Patch. I have the people that I connected with back in my other position from all around Wisconsin. And oftentimes, as someone that's advocating for healthcare needs, someone who is very much marginalized, I feel kind of alone. And Patch has really taken away that empty, lonely feeling that you get when being an advocate sometimes.
Thank you both so much for, I'm Allison who asked the question, and Dina and Aaliyah, thank you both so much for answering my question and for your presentation. Your enthusiasm and passion is so apparent while you're talking, and it's just really delightful to see. And this is going to be like the highlight of my day, I think. Thank you.
We do have time for any other questions. Because the more questions you ask, then the less I have to talk about what is healthcare transition, and I much rather listen to Dina and Aaliyah. So any other questions that might be that you might have for our presenters? Maria might have a possible project, so I will connect with Maria and connect Maria with Patch. How's that?
Oh, yeah. No, it's very simple.
Oh, okay.
16th Street Clinic, Community Clinic here in Milwaukee, just opened a full clinic in South Division High School. And South Division, because we are bilinguals, we are Latinos, and they offer reproductive health. It's not just immunizations, reproductive health. So that was my idea. Maybe we can make some of this, to pass about the kids. How do you feel to have their own clinic in their high school that covers with primary services, including reproductive health.
And I think that sounds like a good idea to me. So we will definitely get you connected to our Milwaukee patch. Well, their Milwaukee patch team. I am not a member of patch. I am just an enthusiastic supporter. But we could definitely get you connected up to Maria, is with Amy. Other questions, comments, ideas that are out there?
I have a question. My name is Joyce. I'm a neurosurgery resident at UW. My question is transitioned from like the adolescents or pediatricians to adult physicians. How do these young people anticipate the transition to be? For example, they've been seeing their physician for the past 10 years, and then suddenly they're 18 or 20. And then who are they going to see? What's that transition going to look like?
So have either of you talked yet with your doctors who you currently have? Are they going to continue to be your doctor after you're 18? Or have you, I mean, you're still a couple years away from that, but have you thought about where you're going to get your health care when you turn 18?
Yes, I have. I know that my doctor is like, I'll be able to conversate with what's most convenient for location as well. But I do right now, I have a couple places in mind plan to stay relatively close-ish to home. So that should work out pretty nicely. And honestly, I don't know who I'm going to go to when it comes to who's going to be my primary provider when I turn 18 or 21 by chance. But I know that I have the tools to figure it out with Patch. It's just that I'm not quite to the point where I need to start that particular journey for healthcare independence yet.
Thank you.
Yeah, and for me, I think like my situation is kind of similar to Aaliyah in the fact that I don't know exactly who my main provider or main doctors are going to be once I'm 18. I do know that I've talked about it a little bit with some of the people, but I don't have a full plan in place. But I'm hopeful that being with Patch will make it easier, maybe to be able to figure out a good plan. So that's exciting.
And thank you so much, Dina and Aaliyah and Joyce. From the parents' point of view, I could tell you one of the first person that I asked with my son, who is also on the spectrum, was my primary care provider, because I already had a great relationship with him. I understood how he doctored, and I thought it might be a good fit. So we connected him that way. Other families talk to each other about what's going on, but the most important person to talk to is that current doctor, and saying, okay, who in the system, because sometimes we are bound by our insurance companies about who we are allowed to see. And so talking to that doctor, talking to the nurse, talking to the people at the clinic, you know, I'm going to be turning 18, or my child's going to be turning 18. You know them, you've seen them for 10 years. Who in this system is going to treat them with respect and is going to be a good doctor for them on the adult side? Unfortunately, there's still issues out there on the receiving of some of our kids, especially with more complicated healthcare needs, into the adult system. But that's not, so we're hoping that will change. And I also know we have other self-advocates who are on the call, and I didn't know if they wanted to talk about just briefly how they located their adult doctor after they had transitioned. No big deal if you don't, totally on the spot, but wanted to give you that option as well, because I know you're on the call. All right. Any final questions for Dina or Leah? And I don't know if we're going to move on or we're going to end, but you know, that's we'll do whichever.
Tim, I did put the Health Transition Wisconsin website and email in the chat. So for anyone, we did have we have quite a few slides about health transition in Wisconsin, or health transition, that will be available after this event, as will the recording. But if you are interested in finding out more information about health transition, for how parents can better prepare for that, prepare their kids, how kids can prepare, then definitely visit our website or shoot us an email and we can share some more information. So Tim, I don't know, what would you like to do? Do you want to, you have a slideshow of health transition, but we have about 8 minutes left.
About 8 minutes left, which everybody's looking at that clock. I think the first thing that I would love to do is to go ahead and thank Dina and Aaliyah so very much. I've had so much fun getting to know you guys and presenting with you. And I don't think we have anything else on the books in 2022. So we'll see what 2023 brings. But thank you both so much for your honesty, your intelligence, your passion. Keep up the great work. Any final words that you would like to say?
I would just like to say thank you for having me. I really appreciate all of our conversations that we have and just the way that we project to all these different people of different communities. And thank you everyone who tuned in. I'm so glad that I was able to share my thoughts, opinions, and stories.
Yes, thank you, Tim. I always love being in here and talking about healthcare. And without Patch, I would not be able to. I wouldn't even know you, Tim. So that. Like again, Patch is amazing, and so is Tim. So thank you.
Thank you. We have fun when we get together. So I really appreciate the opportunity to work with Patch. Beth, if really quick, you want to go to slide 16 and put that on the screen. This is a slide that I like to call Health Transition in One Slide, that I put together just for these occasions when I had approximately 2 minutes to talk about what is healthcare transition. So we're going to go ahead to slide 16.
All right, how about that?
That is perfect. So great. What you need to know about healthcare transition in 2 minutes. Number one is there are tools out there to help you determine where you're at in your planning stage and maybe what more you need to learn. One of the ones we like to refer to is up in the left-hand corner. That's the Transition Readiness Assessment from Got Transition. One of the reasons I like this one, it is customizable to your clinic. You can choose which questions you want to ask, which ones you want to get out. But in addition to just knowing where you're at, knowing where you want to go, we have to keep in mind that we have this time before the actual transfer of care called this time of preparing for transition, where we have the opportunity to grow in our knowledge, in our skills, and in our attitudes about who is going to make those decisions, how are we going to take care of ourselves, what are our values in taking care of ourselves, our values in our health. And so that whole preparing for transition will lead up to this time of transfer of care, where there's an actual change in clinics or a change in doctors or a change in style. Is that even if you're seeing a family provider, there's differences in adult care than there are in adolescent and child care. But the goal is to have all adolescents and young adults fully integrated into the adult healthcare system. If you would click one more time, Beth. And so we want to get into that fully integrated system where we are helping our kids during this time of preparing. We're helping our adolescents, young adults build their knowledge, increase their skills, take on that attitude of this is my health. And so as we're in that time for transition, you see some tools that we have available there. But I think more important than the tools are asking questions such as, what is it that youth and that young adolescent can do to take charge of their healthcare? What can the family do to help transfer the knowledge they have about the healthcare system to their youth and to their child? What can the health professionals do to increase the self-advocacy of those youth, to talk to the youth and young adults directly? How can they help can they help locate those adult providers? What can educators do to make health part of that transitional time in school? Because health is foundational to success in employment and in higher education. Wherever you're at, you can have a part in helping youth and young adults prepare to be fully integrated into the adult healthcare system. So there you go. Healthcare transition in 2 minutes. Thank you, Beth. Oh yeah, that next slide was totally, this is what it's supposed to look like, is over there. We have the youth in charge of the decision and they have those skills, but we know that it's going to be different for each person. So we then do have some resource slides that you can get more information. Beth will have these posted as well. Excellent national resource and got transition. Our website at Health Transition Wisconsin that includes more information about those 8 tools that you saw briefly there that could help increase. Pacer Center out in Minnesota has been going on health transition for a long time. And then up to me is Wise Wisconsin. And I love what they do around disclosure and how do I talk about what's going on inside of me and how do I share it with other people appropriately. You can always get a hold of us at the Youth Health Transition. There's my number as well as my address. Thank you all so much for hanging out to the very end and for listening. Please give us feedback. Thank you.
All right, I'd like to ask that everyone please go to the evaluation link in the chat and fill out that evaluation. That really will help us out. And we hope to see all of you in 2023. Thank you.